Promise Healthcare is on a mission to improve the health and well-being of the diverse communities they serve by providing high-quality, equitable healthcare to people of all ages. Here today, sponsoring our segment and to talk about behavioral health is Jim Hamilton. Thank you so much for being here.
Glad to be here, thanks.
All right, so tell me a little bit about Promise Healthcare's integrated health program.
So integrated healthcare is when providers work together, they collaborate, they communicate together, and it leads to better patient outcomes. We treat the whole person and not just going to primary care or going to mental health or going to dental, but we provide all those different services, and we have those different service lines talking with one another.
And I think that that's really important, especially in today's day and age where there are all the different health portals and all the different places where your records are and things like that. To have it all centralized in one system where all of your healthcare providers can see it is really important.
Right, absolutely. We're local. We're right here in the Champaign-Urbana community. We have behavioral health, which is counseling and psychiatry. We also provide substance use treatment in our behavioral health program. We have a dental program that does a complete array of dental services. And then we have our medical program that provides primary care, family medicine, women's health, prenatal, all kinds of different medical services.
And what is a federally qualified health center? What does that mean?
Federally qualified health center is deemed by HRSA. Let's see if I can remember what the acronym is.
I was going to say that's always the hardest part. What do the letters stand for?
It's Healthcare Resource Service Administration. It's a federal agency, and they oversee programs like ours. And being a federally qualified healthcare center, one of our prime missions is to make sure that underserved populations have access to healthcare.
And you do that by sliding scales and things like that. Can you talk a little bit about how the pay structure works?
Yeah, we have a sliding fee scale, and it's based on a person's income. So for somebody that's below the poverty limit, they're going to have very low rates of services. I know of different rates of $2 and $3 for an appointment. So it just kind of depends on income. But we will serve anybody, even if you don't have the ability to pay, we're still going to provide you services.
And I think that that's really important, especially nowadays, because there are so many people that desperately need care and are struggling to find it. So I'm glad that you do that. Right.
So yeah, I think we provide a full comprehensive array of services. Like I said, medical, dental, behavioral health, but we also offer case management, which helps some of those lower income people kind of navigate not only the healthcare system, but also kind of help them navigate the social drivers of health in the community, like making sure you have good housing, good transportation, able to pay your utilities, have access to food, and you don't have to feel food insecure. So we have a complete care management program that can address those kind of issues.
Wonderful. Well, thank you so much for being here and for sponsoring our segment today.
No problem. Happy to be here. Thank you.
If you want more information, you can visit us on the web after the show at ciLiving.tv, and we would be happy to connect you with Promise Healthcare. Still ahead on ciLiving, Project 47 Smokehouse will be joining me in the kitchen, and then later Champaign Center Partnership is here with Jane Addams Books. ciLiving will be right back.